Now we're switching gears into health matters. There are many deaths that occur in the country that if they were acted upon sooner, they would not have occurred. Now, for this reason, we are having a discussion on emergency medical services in the country. Do we have enough facilities that care for emergencies? Do we have proper infrastructure laid for emergencies that may occur in the country? And what are we doing right? Where are the loopholes when it comes to emergency services in the country? Now, joining me for this particular discussion is the Managing Director, Emergency Plus Medical Service, that is Dr. Christine Memusi, and Felix Musila, who is their Communications and PR Officer. Welcome to Good Morning Kenya.
Thank you, Vivian, for having us.
How are you doing this morning?
You're very well, thank you. Yes.
It's a pleasure to have you on set so that you can just get to talk about this particular topic that is on emergency medical services, that I believe is a topic that we should bring awareness on. If we may just go straight into you telling us, I will begin with you, Felix, what the Emergency Plus Medical Services is all about.
Okay, thank you, Vivian, for having us. Let me start by saying that E+, or basically the Emergency Plus Medical Services, is a private commercial company or entity fully owned by the Kenya Red Cross Society. We do specialize in the business of provision of what you call pre-hospital care. People basically will. We are fully owned by the Kenya Red Cross Society, and we have operations in all the 47 counties. And we are arguably, East Africa's biggest ambulance, ground ambulance provider. Yes.
Before we get into matters ambulances, because I believe that is something we're going to be talking about in depth right here. Probably, Doc, you may tell us, do we have enough facilities that cater for emergencies in the country?
Thank you, Vivian. So when we look at what WHO states, that one ambulance at least should cater for about 70,000 to 100,000 people, and we are able to amount or count all the ambulances that are in Kenya, we are still very far. But when we look at what we as E+ are able to do, we have the largest number of ambulances in the country, and thus in terms of our brand, we are leading in that area. But can we do more? Yes, we actually do need more. Looking at the 54.5 million Kenyans that we are, we surely need over 2,000 ambulances. So there is a need there. There is a need to have more ambulances to cater for the needs of the Kenyans at large. Yes.
Can every doctor attend to an emergency, or is this a specialized area that specific doctors get to go study?
Okay, thank you for that. So when we talk about pre-hospital, the point pre-hospital means it's care that's given outside of the hospital scenario. So in that situation then, those who provide the care are not called doctors per se, but are paramedics and emergency medical technicians. So this is a new area in Kenya that's growing in terms of capacity building and growth of a cadre or of a speciality. Those who end up doing paramedicine or EMT don't have to go to medical school. There are schools that offer emergency medical technician courses. Emergency medical technician is a certificate course. Kenya Red Cross Training Institute offers this course for a duration of 6 months. Now, once you're done and you get certified, then you can practice as an emergency medical technician in an ambulance, running what you call a basic life support ambulance. And if you want to go further in the scope of your practice, then you go back to school and you do a paramedic diploma course. Kenya Red Cross Training Institute again offers the diploma course, which is 2 years, and you become a paramedic. There are universities that have tried to start paramedic as a degree, but that's work in progress. And so that's basically what entails pre-hospital care. It's usually manned by emergency medical technicians and paramedics. So who would fit? Anyone who is passionate about giving first aid. I do believe the passion would start from those who did first aid in high school or in primary school, who see a need to give those life-giving care outside of hospital. So then comes a need and a birth for taking care of or giving that first care that's really the key and makes a difference in terms of those deaths that you mentioned that can be salvaged. So those who actually are passionate about taking care of the sick outside of hospital or giving that the first treatment to any care to save life, and I would say adrenaline junkies who are willing to deal with different scenarios, whether it's a case of a fire and you're called to the scene, whether it's a case of someone who has just fallen down, maybe they've gotten a heart attack and you're called to the scene, or a stroke, different scenarios. If that is who you are, then this is a course you should think of, emergency medical care.
Okay.
Yes.
Felix, do we have a national emergency number that someone from anywhere can call in case of a medical emergency? Do we have that?
It's a bit unfortunate because we do not have such a number. The different kind of responses we have in this country are more or less fragmented. For example, when you come to E+, when you want to request for an ambulance, we have a short code which is 1514. If you call, the Nairobi fire station, I believe they have their own, emergency response number. When you call the different, ambulance provider in this country, each and every EMS provider has their own number. When you have, when you want, intervention or help from, the security agencies, they do also have their number. So there is no one common number for you to call when you have an emergency. And I think that is what, should be adopted going forward, because, learning from what other countries do best. For example, when you go to a place like the US, for example, if you have any emergency, be it a fire incident, be it a medical emergency, be it a crime situation, be it any kind of emergency, there's that 911 number that is used to call. But when you come to Kenya, for every different kind of emergency, there's a specific number for us. Yes. Okay, so you've mentioned a number that one can call. There's no particular number, but there's one you've mentioned. If you can just repeat it, the 15. Yes, it's basically what you call a toll-free number. That is 1514. And that number functions 365 days in a year. It's operational 24 hours in a day once you call. On the other end, we have, like Doc said, trained medics who are on standby to advance that medical intervention for you. 1514 is toll-free.
Okay. Yes. Now, what are some of the loopholes, or what are some of the gaps in the emergency system in the country, if you may take that question? We already have seen one where there's no particular number, there's no number for emergencies, a national number. So what are some of the other loopholes or gaps in this emergency system?
A while ago, we had a big gap because the different EMS providers in this country did not have what you would call as a regulatory framework to operate within. Basically, we had no standards. If you wanted to get into this EMS industry, what one needed to do was to simply purchase a matatu, and then just put a stretcher in it, and then just label it and brand it as an ambulance. But with the enactment of what you call the EMS care policy and strategy, at least now we have standards. We have a proper definition of what will constitute a properly and a well-equipped ambulance. We have also standards for people who are supposed to work in an ambulance, because previously we only had basically just a normal driver, quote unquote. But what Dr. said, now you have to be fully trained. to the levels of either basic life support or advanced life support for you to be able to, operate an ambulance. So one of the problems we had, in the beginning with that was that we didn't have a proper, framework to conduct the EMS, business. But now we have a strategy to it. And then the other challenge is that we had a somewhat of an abuse of what you call emergency medical services. Sometimes you have people calling in and after careful assessment you may be able to deduce that what this individual is requesting for is not basically an emergency. Because if you're just seated at home and you have just a minor ailment which is not really life-threatening, then that cannot be construed to be an emergency. So lack of awareness or not would constitute an emergency is also another problem that we've had in this EMS industry.
Okay.
Yes.
What is your main focus as an emergency doctor?
The main focus is to save life. When the Health Bill Act was put in place, or was passed as law for Kenya, the aim was to basically be able to revert the unavoidable deaths or morbidities that happen. In a situation where, for example, if you don't manage a stroke patient quick enough, it results to early death or disability, which really is unwarranted. And those are the numbers, those small numbers are what makes a difference. It's not the mass casualty incidences that we have, but it's really being able to revert the incidences that happen, the unavoidable deaths and morbidities. And that's what is key for EMS and for any EMS provider or doctor, to be able to save that life that could have been avoided. That child who is choking, that patient who has received a certain percentage of burn injuries, saving that life is what is essential to avoid unnecessary or untimely death or morbidity.
Okay, on that note, we'll take a short break, but don't go too far. We'll be back to continue with this conversation.
Serikali ya kaunti ya Turkana ya kualika kwenye kitovu cha utamaduni cha Ekales, eneo la Lodwar, kwa makala ya 7 ya tamasha ya utamaduni wa Turkana na utalii. Tangia tarehe 12 hadi tarehe 14 mwezi Oktoba mwaka 2023. Njoo ujionee asili ya binadamu pamoja na visima vya mafuta vya Lokichar. Kenye kwenye runinga ya KBC Channel 1, Radio Taifa na idhaa ya Kiturukana.
The National Construction Authority, NCA, is the legal body mandated to regulate the construction industry and coordinate its development. The authority, in partnership with KBC Channel 1, invites you for an accreditation drive and safety sensitization exercise under the theme Usalama kwa Ujenzi on Tuesday, 3rd October, 10th Street, Eastleigh. There will be entertainment and free education on matters of construction in Kenya. Come meet your favorite presenters and artists including Juakali, Mgenge, Dufla and Diligon. The exercise shall kick off from 9 a.m. from 10th Street, Eastleigh, next to Huduma Center, where we shall offer accreditation for construction workers and site supervisors. To be accredited, please carry a copy of your national ID, passport size photos, copies of academic certificates or recommendation letter from an NCA registered contractor. This exercise shall then be followed by a roadshow flagged off by the Kamukunji Constituency Member of Parliament, Honorable Abdi Yusuf Hassan. The roadshow will proceed to Shauri Moyo, Majengo, Bahati, Kariobangi, Fedha, Pipeline, Kayole, Dandora, Kangundo Road, Mwiki, Kasarani, and end at Roysambu. Jenga Haki, Jenga Smart. The National Construction Authority, promoting excellence in the construction industry.
1 year in office, 23 ministries. Time to review the journey in implementing the bottom-up economic transformation agenda. What is your assessment of the government's performance? Will they ace the performance test? Tune in to KBC News at 9 p.m. for the government scorecard.
Okay, and we are back right here on Health Tuesday. Good morning, Kenya. And our discussion today is on emergency medical services in the country. And if I may just get to you, Felix, maybe what goes on when someone calls that toll-free number of 1514? They call you, they have an emergency. Take us through that process. What is the procedure from there?
Okay, basically, when you call the toll-free line 1514, the person on the other end receiving that call is a trained medic. First of all, they'll ask you for your location, they'll ask for your name, and then they'll ask you questions about your condition. Or if you are maybe standing next to a person who has an emergency, they'll ask you questions about, the medical situation of that individual. And upon you giving that information, they are able to, first of all, decipher if that is an emergency and if it qualifies for, what you call an ambulance evacuation. Because contrary to what many people may think, an ambulance may be dispatched to you, but it's not really a necessity that that ambulance has to evacuate you to our hospital. We also do what you call treatment and stabilization on site. That means we give you that medical intervention at your place of emergency, and once the paramedics are able to discern if you're okay, you can basically there's no advancement of you being transferred to a medical facility. So once you give that information, then we have a system that will automatically allocate an ambulance that is near you. Yeah, so and by the time that ambulance gets to that person who has emergency, we normally issue what you call pre-arrival instructions. Pre-arrival instructions will mean basically medical instructions that are able to more or less better the situation, such that by the time the E-plus ambulance arrives, the situation has not really aggravated to another level. So that is what basically happens when you call for an ambulance using a toll-free line, which is 1514.
Okay.
Yes.
Now, every Kenyan has a right to emergency treatment according to our constitution, but we know that sometimes this is not the case because I may be having an emergency, but I don't have money. I don't have money, and sometimes this comes in the way. What do you have to say concerning that? I call you guys, I have this emergency, but I don't really have the money to cater for your services. What happens?
Right. Thank you, Vivian, for that question. The law is very categorical, or the health bill is very categorical that no Kenyan should be denied emergency care services. Now, the emergency care services initially begins at the pre-hospital care. As E-plus, it's our mandate in part of our corporate social responsibilities to actually evacuate any emergency of someone who has no monies, or for example, the road traffic accident casualties for free. Now, where the money or the monetary element really applies to is in the hospital scenario, because we will evacuate that patient with an ambulance for free. But in the hospital, it's a mandate and it's a right that in a hospital situation, when you're brought a patient who is critical, that it is by law that you have to provide services to that patient to revert the emergency state from worsening, so that you actually prevent, like I said earlier, the morbidities and the mortalities that are unwanted or are early. And so that is what it entails, that every Kenyan should know their right, that in an emergency state, no hospital should prevent to provide for you the care, because by law they should be able to give you that care to revert your illness or that emergency, to prevent further worsening or death. Yes,
I get that. Now, do we have enough ambulances in the country? Do we?
I would say, unfortunately, no, we don't have enough ambulances in the country. You know, just drawing from what we have, only a number of ambulances are what you call well-equipped ambulances. Because contrary to what, you know, a lot of people may see out there, not all ambulances are what you call well-equipped. You know, some of them, you know, are just basically, you know, what you call maybe
transport vehicles.
Transport vehicles. They are not basically equipped to the standards, you know, that are recommended by the WHO in terms of, you know, a well-equipped ambulance. So we do not have, you know, enough well-equipped ambulances in the country. Yes.
Okay, and so when you talk about a well-equipped ambulance, what are we talking about? And do we have different kinds of ambulances?
Yes, we do, Vivian. So a well-equipped ambulance is an ambulance that can save your life. That's the message that I would start with. And by saving life, it means that it's not about the speed, but it's a care that's given. And when we talk about care, then we're looking at what is inside that ambulance. So the Kenya Bureau of Standards has regulations of what an ambulance should have in terms of stocking, capacity, space. And so when we talk about stocking, we're talking about consumables. So the equipment, what is it for someone who has a respiratory compromise? Are you able to give me oxygen? Someone who has a cardiac problem, are you able to give me drugs that can save me on transit to hospital? Someone who has broken limbs, are you able to basically support the limb, or even arrest the bleeding if there's bleeding from the site of the injury, to actually prevent loss of life because of hypovolemia, which is blood loss. Someone who is in shock, are there fluids that you can give me to be able to ensure that you're reverting my shock states? So that is what an ambulance is. It's a care. It's not it's the care that's given, and it's what is inside the ambulance that saves someone's life, the ability to save their life. At the same time, that ambulance is manned by well-equipped professionals who understand their scope and are able to use the consumables in a way to save life. So when you look at an ambulance and the types of ambulances, we basically have two types of ambulances. We follow very much the Anglo-American emergency medical services equipment and standards of care. So we have what we call a basic life support ambulance. One, it's manned by an ambulance operator and an emergency medical technician. By just saying an ambulance operator, it's really alluding to the fact, and should emphasize the fact that our ambulance operators are not just your everyday matatu driver or, you know, PSV drivers, but these are trained staff. They have first aid training on top of the defensive driving on the road, so they know how to maneuver the ambulance in the right and appropriate way to ensure that they reach their destination in the right and careful, you know, with care. With care. Then when you look at the emergency medical technician, like we said earlier, these are trained professionals. They have gone to school. It's an upgrade from our first aid, so they're able to save life. So in the basic life support ambulance, that's one type of ambulance that is there, manned by an EMT and an ambulance operator. Now, when you advance, when that EMT advances, and due from skill, as well as going back to school and gaining more knowledge, then they actually man what we call an advanced life support ambulance. So an advanced life support ambulance to us is what we call a moving ICU. This is a patient, any patient who is evacuated using an advanced life support ambulance gets the same care like in an ICU in any hospital in Kenya or wherever you can imagine. So we're able to manage this patient adequately. We can ventilate this patient if the need arises, and ensure that they reach hospital with the right care and the right management already commenced. Yes.
Thank you for that. Do you feel like we've done enough awareness on such services? Because I believe that as Kenyans, most of us, when we have emergencies, when you have a patient who requires urgent attention, medical attention, we tend to try move from one hospital to the other, we take a cab. Have we done enough awareness of such services, that is the ambulance services, because that's the way to go when you have an emergency patient?
That's true. We need to do much more. We need to market more. Kenyans need to know about this short code or the other hotline numbers, the 0700 395 395 or 0738 395 395. Those are the same emergency hotline numbers that will direct you to our emergency dispatch center for emergency plus medical services. We need to actually educate many more Kenyans to understand that during an emergency, there is more harm done in using your your ordinary Uber driver to get you to the hospital quickly. We need to understand that emergency medical care is not about speed, but it's the initial commencement of treatment of any emergency that arises that makes the difference. If you were to commence management for a stroke patient from when you receive this patient at home, it does more good than harm than using an Uber driver who takes you very quickly to the facility, and then the facility now has to begin from scratch in terms of managing you. When we commence our management from pre-hospital, when we deliver you to the hospital, it's a continuity of that care. And that's what makes the difference in terms of how quickly you stay in hospital vis-a-vis how long you stay. So that care is essential, and we need to really market these services for people to understand that these services are essential. It's an essential service as it is, but it's essential for you to know these numbers, and it's also important for you to know what to do in a state of emergency to be able to revert those morbidities and mortalities, or to revert the long stay in hospital vis-a-vis just the continuum. So it is essential, it is important. We need to market these services more and more.
Yeah, yes. Maybe I can just, let me just add to what Dr. has said, that, Kenyans need to be sensitized on the importance of having an ambulance within reach. Because, as Kenyans, we have, this mentality that when someone is in an emergency situation, it's all about speed. But like Dr. said, many times it's not about the speed. It's about, it's more or less about the care that is advanced to you inside an ambulance. So when, for example, you are in an emergency situation, and you call for, let's say, a taxi, or you call your friend to rush you to the hospital, that may not really help you much, because supposing your situation gets or worsens inside that private vehicle, what happens. But when you are inside an ambulance, a paramedic is there giving you care from the point of the start of the evacuation to the minute that paramedic will officially hand you over to a doctor inside the hospital. So the care is unlimited so long as you are inside that ambulance. But when you request for a taxi or a private vehicle, that may not really get to help you. So I think it's a high time that Kenyans get to appreciate that it's always advantageous for you to request for an ambulance as opposed to requesting for another form of transport.
And if I may cut you short on that, how do I know if there's an ambulance within my reach?
Okay, it's a bit tricky to know if you have an ambulance within your reach, but you know, it basically calls upon you to undertake to know that. For example, what at T+ we do, we have stationed ambulances, you know, across every part of this republic. We have you know, ambulance you know, distribution across all the 47 counties. So even if you are at the far end of Kenya, you know, so long as you place that call to that number that you know, we shared earlier, an ambulance will be dispatched to you in the shortest time possible. Yes.
And maybe have we sensitized? Have we done enough sensitization rather to public road users? Because I've seen cases where an ambulance is stuck in traffic, which is not supposed to, it's not supposed to happen. So have we done enough sensitization on just public road users?
Thank you for that. So according to the our road ethics or ethos as a country, those vehicles that are given priority of way, one of them is an ambulance. And I do believe for those who drive, whenever you hear the horn or the hoot of an ambulance and the siren and the lights, you give them priority of way. So there is a lot of sensitization on matters of giving ambulances the priority of way. So that is known. That is part of ambulances, as well as the motorcade for heads of state are part and parcel of the vehicles that you should always give priority of way. And the police actually, whenever they hear the siren, you always see them trying to clear the traffic for that. Yes.
And are our roads maybe well designed to handle such emergencies? You know, are they well designed to accommodate, you know, ambulances, fire trucks in case of emergencies? Would you say our roads are well designed for that?
Well, if we are to compare with the West, then we'd say no. But from where we have come from, there's an element of trying to expand our roads in the country. More needs to be done. But so far, what we can say is that, for example, in the interior parts of Kenya, where the terrain is rough and all, there needs to be tarmacking of those roads. But those are county regulations. Those have to come from the county and the roads, Kenya roads, to ensure that all roads are tarmacked and accessible, because that inaccessibility also hinders how quickly an ambulance can get to you. You know, if you look at if the roads are not there and there's an emergency and the ambulance has to reach you, what do they do? And so in that improvisation, then we need to really understand that an ambulance is not only just a vehicle, but an ambulance can be in the form of a boat, an ambulance can be in the form of a helipad, a helicopter, or a small plane. An ambulance can also be in the form of a donkey, because in some areas people have used donkeys.
In the form of a donkey?
Yeah, with a cart, as long as it has a first aid and someone who can be able to give the care. That is what an ambulance can be, because we always think of an ambulance as a vehicle, but a vehicle can come in very many forms. In places where, island areas where it's only water, then the ambulance is in the form of a boat. Yes, in those rough terrain areas where there's no road, then a donkey can do the job, or a bicycle or a bike. And we're seeing a mandate by the government to try and see how they can use the same borders and educate them on first aid, because when they have those skills as first aiders, then they're usually the first on the scene. They can actually make a difference to the lives of those who are involved in road traffic accidents, or in the lives of those they are called for. And again, there's also a lot of work being done to sensitize community health workers, because they are the ones who are usually in those communities. Can they be equipped as first aiders, even have a first aid kit to be able to give interventions before an ambulance reaches them and make the difference? Yes.
Maybe what do you think can be scaled up generally around this, area?
First of all, let me add on to what Dr. previously mentioned. Sometimes it also boils down to our ethics as a country. When you are a road user and you see an ambulance that has sirens behind you, what do you basically do? Do you try and compete, with that ambulance for, space within the traffic? Or do you excuse that ambulance so that, the person who's being, evacuated using that ambulance can get, that proper care within the shortest time possible? Because we've had incidences in the road before where, you can clearly, hear the sirens of an ambulance behind you. And instead of being courteous enough and giving way to that ambulance, you try and, outmaneuver that ambulance, or you try and, just meander your way through traffic by following through that ambulance. So sometimes, it's also a call to Kenyans to also, be more courteous enough, when you hear an ambulance siren, kindly give way, because, that person who's in that ambulance is in need of that dire care more than maybe you do.
Okay.
And, just coming back to your question, what can be done? I think more awareness in terms of people knowing about and understanding, the critical role of emergency medical services in Kenya. A lot of people do not know. Actually, if you were to take a sample of maybe 10 people in a street and ask them what will happen if someone seated next to you would be in an emergency situation, most of them actually tell you, I would call for an Uber, or I would call a friend to take my friend to the hospital. Many people not even mention an ambulance. Yeah, so I think much more awareness should be done in terms of upscaling, the knowledge of emergency medical services in Kenya.
Okay, yes. I get that, and we're going to get into some first aid tips that everyone should know in a moment. But just a question to you, Doc: is there a duration limit that a patient should wait in an emergency room? Is there something like that?
Emergency room in a hospital?
Yeah.
Well, I would say yes and no, because one, it's based on when you find yourself in an emergency department in a hospital, you're not there just to waste time or for time to pass by, but the medics around you are trying to ascertain your type of your condition. For example, if you just landed, not having been handed over, because I just need to emphasize that when you look at what we do, and in terms of our operation, when you call the dispatch center, a medic gets the call. The medic is able to ascertain, one, where are you, so that they're able to send you the nearest ambulance to you based on our ambulance mapping and our adequacy in ambulance mapping in the country. And when the ambulance gets to you, then they're able to begin the treatment on site of what your injuries is. But at the same time, this ambulance team is notifying the dispatch center that we are carrying patient A and they have this condition, and based on this, the facility that we know can manage this is facility B, and it could be 10 kilometers away. Vis-a-vis maybe a facility A, which could be 3 kilometers, but is not fully equipped to manage your condition. That information is essential. Now, when the dispatch understands that we are carrying this patient and we are taking to facility B, which is 10 kilometers away, the dispatch is notifying that facility that an ambulance is coming en route to your destination. Will be there maybe arrival time in the next maybe 10 or 15 minutes, and they're carrying patient so-and-so, and patient so-and-so has this condition. That already prepares that hospital and that emergency department to know that this patient is coming. And you see, that care, that whole complete circuit is what is pre-hospital care. Now, if you are to compare that with just being picked by your Boda or whatever it is and being rushed to hospital, the hospital doesn't know you're coming, so they'll not be equipped, they'll not be ready. And so they'll have to start from scratch. So when you talk about how long should we say is long enough to stay in an emergency department, then that depends on, one, the nature of the injuries or the natures of the emergency this patient has. Intervention is already managed in the emergency department. You can be in the emergency department even for 2 days, but not just sitting there time passing by, but care is really commencing. But when you look at turnaround time for hospitals, that varies on the turnaround that they have said that we should have a turnaround time of at least 12 hours, meaning that every patient who comes to the emergency department is managed, diagnosed, and treatment commenced before then moving them forward to the respective wards within the hospital for the continuity of that care. So it really varies based on, one, the nature of the condition, two, what is their turnaround time as a hospital, what have they said that is efficient. Mostly it should be within 12 hours, meaning that in that 12 hours they should have known your condition, they should have begun to stabilize you. If it's taking you to theater, they should be able to take you to theater within that 12 hours. But when I said about conditions varying, when you look at, for example, what we call PCI for someone who has a heart attack, they talk about door to door, being about 120 minutes, meaning that from the time you're picked to the time you get your intervention in the cath lab should be about 90 to 120 minutes. So it varies based on what is your condition, and then every hospital has their own turnaround time, but mostly, generally, it should be within 12 hours. You should be able to have been managed and discharged to the wards, or if they can manage and treat you, then discharge you home.
Yeah.
Yes.
Now that you work for emergency care, I am sure that you have handled a lot of emergency cases in the country, that is pre-hospital cases. Are our hospitals rather well equipped for that? Because you definitely know what hospital to take which patient. Are our hospitals well equipped for that? Or is there a time where you sit wondering, we've done our pre-care, but which hospital are we taking this patient to? Maybe they're full. Are we well equipped?
Well, the well equipment, I don't think we are able to basically stand and give an answer to that, because that's since health was devolved in 2012, it became the mandate of the counties to ensure that their hospitals from level 4 to level 5 are well equipped. What we do as EMS, and why we have actually seen a role of us, the importance of having EMS working with counties and working in this country, is the strengthening of the referral systems. So when it comes to strengthening of referral systems, truly we have endeared to that, and many counties that we have partnered with have seen the value addition when we onboarded our services with them and provided them this care. And when we talk about strengthening the referral system, it means that a level 3 hospital that receives, for example, a mother with a cord prolapse, a pregnant lady with a cord that has prolapsed, and they do not have a theater, then we come in and are able to evacuate this mother from that level 3 facility to a level 4 within the same county, or level 5 within the same county, that is able to operate this mother immediately, to be able to revert the death of the infant, and to be able to also revert any worsening state of the mother, because a dead baby in a mother's womb basically becomes a septic, becomes an infection to this mother. So that's how we're able to come in and strengthen the capabilities of our hospitals. We can only hope that by working hand in hand with them, that we have also been able to strengthen them to be able to go a step further, because when you are dealing with us as a provider, and we are able to come on the ground and be able to even help you on a day-to-day, it actually becomes a plus to those facilities and all. But to be able to say if they're well equipped or not, we might not be in a position to answer that. But we hope that they are. But in terms of how we have worked and partnered with the counties and the facilities, and the facilities that we have referred patients to, we know that we refer them to facilities that are able to manage the conditions and save lives at the end of it all.
Okay. Yes. Generally, so far, are we in the right track when it comes to emergency services?
I would say yes, because first of all, the number of ambulances in this country has increased. We are now seeing significant players coming into the market with what you call well-equipped ambulances. As for E+, we have invested quite heavily in ambulances, well-equipped ambulances, equipped to the level of what Dr. said, ALS, advanced life support. We have also invested heavily in what you call a state-of-the-art dispatch center. We are able to manage up to 500 calls in a day. We are also able to manage all manner of conditions. We also continue to upskill our paramedics and also ambulance operators. Because EMS is a very dynamic space. Yeah, so I think we are on the right track, and also with the enactment of the EMS care policy, I think now we operate in a space that is a bit regulated. So I would say that yes, we are on the right track.
Okay.
Yes.
That's good to hear. Now, Doc, if you may just take us through some of these first aids as we finish up with the interview. I am next to someone who's choking, or maybe I'm feeding a baby and they choke. What should I do? What's the first response?
So the first response is never try to make them vomit. Never try to insert anything in that child's mouth to vomit. What you should encourage is for them to cough it out. So for a child, there's what we position on the leg for the neonates, and the aim is to give back slabs, at least 5 adequate back slabs, to ensure that this child is able to cough out. For any child above 2 going onwards, there's or anyone that you can be able to basically be at almost at the same height as you. The aim is then there's what you call the Heimlich's technique, where you try to actually help them again cough out the obstruction. So the back slaps or the Heimlich are first aid techniques that can actually help this person cough out.
Is
the child, the back slaps, an adult, the Heimlich maneuver.
Is there a technique to the slaps on the back? Do I just slap someone's back?
So the aim is to always back. The aim is to always hit like you're hitting the back towards the head, because the aim is to try and basically cause the diaphragmatic muscles to cough it out. So you're actually using force. But in every first aid, the first thing is always shout for help. So whether shout for help as you do this, get someone to call an ambulance as you're giving the back slabs.
Okay.
Yes.
Someone is having a heart attack?
Someone is having a heart attack. So the position, because remember the attack is, it's an attack to the cardiac. So are they conscious and unconscious? So if they're conscious, because many times for a patient who is having a heart attack, it's not like they'll collapse. They will have that syncope, like fainting. They'll have the chest pains and all. So the first aid is always to put them in a half-sitting position, whether it's a pillow in between their legs, and if you have junior aspirin, junior aspirin is the first aid drug to give. Remember, always shout for help as your first thing. Shout for help. Put them on a half-seated position. If they're able to chew, give them the junior aspirin, 4 tablets of baby junior aspirins, because a junior aspirin tablet is about 75 milligrams. So at least 4 of them will get you to the recommended dose of 365 or 325. And they're able to chew as you call for an ambulance.
Okay.
But if they're unconscious and you're first aider, then this is where we say where we need to go as a country, where we need to go as a people, is to be able to have automated electrical devices where just like a first aid kit. I hope KBC has a first aid kit or an AED. That AED, given that fast shock, makes the difference in someone with a heart attack. And yes, that's where we need to go in terms of how do you have first aid champions within companies, how do you have first aid champions within schools, higher schools, or where there are many people, do they have these devices to be able to revert? Because an AED can save a life in someone who is unconscious after they've had a massive heart attack. That AED, that fast shock, makes a difference before you start the CPR.
Okay. Someone has just fainted. What am I to do?
Someone who has just fainted, the aim is I know the sun, like right now, we're getting a lot of solar as we wait for El Nino rains. Keep them away from the sun. Move them towards a shade. Loosen any clothes. Always elevate the head. And then just wait. They'll come out of it. But remember, we stayed shout for help as fast, yes. and get someone to call an ambulance as you give this first aid skills or first aid medication to be able to revert that.
Okay. Yes. Thank you so much for joining us for this particular conversation. It was really, really insightful, and I hope that we are, for those of us who are watching us from home, I believe that you have gotten a thing or two from this particular interview, and you have gotten to know how to just do some first aid, you know, for different situations. Thank you so much for coming. And continue doing.
You can give the emergency numbers if you don't mind.
Very quickly.
Yes. Number one, you have the the toll-free line, which is 1514. We have another hotline line that is 0700 395 395, 0738 395 395. Very important numbers. Thank you.
Okay, thank you very much. You have gotten those numbers. In case of any emergency, you can reach out to those to the toll-free numbers. And one more thing, whenever you are on the roads and you get to hear of a siren that is coming from an ambulance, kindly give way, because you may be saving a life. Okay, this is where we end Good Morning Kenya this beautiful Tuesday. I will see you tomorrow, same time and place, God willing. Do enjoy the rest of your viewing.